Välkommen till FHS COVID Infodrive 2021. Good evening. My name is Eloisa Febalagat, and I'm an au pair from San Vica and a volunteer of the Filipino Helping Society o det Filippinska Hjälpesamfund in Norge. From FHS Team Helsa o Validihet. And I am here with my teammates Jons, Jing, and Stephanie, and you can call us the PandemChix. Together, we will give you updated information about the infection control for COVID-19 in Norway. Before we start, let us hear a short introduction from my teammates, Jons, Jing, and Stephanie.
Thank you, Eloisa. Hi, everyone. My name is Jons, and I am a student in Oslo. And also, I am a volunteer of the Filipino Helping Society, or FHS team, Helsa or Valditihet. It is nice to meet you all.
Hi, thanks Eloisa and Fe. My name is Jing. I am nurse in Philippines, but now I'm studying here in a Bible school and also a volunteer of Filipino Helping Society or FSH Team Halse o Veldidiha.
Thanks everyone. My name is Stephanie and I'm a volunteer of FHS Filipino Health Sampun Team Health of Health. And I am welcoming you all to our newest program, FHS COVID Infodrive 2020.
Thank you, Jons, Jing, and Stephanie, for the short introduction of yourself. Now, let us focus and begin in the advice for travel. Are you planning to travel or are you planning to have a trip? Especially now, it's Easter holiday. So mostly everyone are going to their hitta, cabins. Well, I'll give you the advices for the infection control when traveling during this COVID-19 pandemic. This is according to the Norwegian Institute of Public Health or from the www.fhi.no, last updated March 17, 2021. Next, please. So the Norwegian Institute of Public Health updated that they advise everyone to avoid all foreign travel or unnecessary travel or less domestic travel in Norway. But there are some exceptions and I can share it later. So if you're planning to go to your hitta, cabins, or travel to other municipalities, you have to know first. Next slide, please. The General Infection Control Advice. I make it into a abbreviation, which is SFHD. So it will be easier to remember. S, stay at home when you're sick. F, wear your face mask. H, do hand hygiene. And D, keep 2-meter distance. So always remember the General Infection Control Advice, SFHD. Next slide, please. So now is the advices for travel and holidays in Norway. So the first advice is that you have to travel mostly with your own family members or with the household or others you already have been in contact with at home. Next to consider is consider what you'll do if you become sick and need to be isolated and go into quarantine. Remember your travel insurance coverage, whether it applies. So you have to call them if you become sick so that it will be covered with your insurance. Next slide, please. So next is especially now it's Easter holiday. So usually everyone now are going to the hitta cabins or up to the mountains. So it is allowed to travel to your cabin, to your hitta, but if possible, you should avoid a public transport. So you can enjoy as long as you are in a fewer people or fewer crowds, and especially in your hitta, and you should be with your own household. And yeah, next slide, please. So, when traveling from an area in Norway with high infection levels to an area with low infection levels, you should limit contact in the first 10 days, which is the quarantine period. Pay particular attention to symptoms and do hand hygiene. And if you believe you are exposed to infection, you are encouraged to take a test, the COVID test, and also keep 2 meter distance from people in risk groups. Next slide. So for students and other people who are staying in areas with widespread transmission over a longer period should follow the advice from the Norwegian Ministry of Foreign Affairs and local health authorities and educational institutions and employers. So for students, you can check your university's website or the respective municipalities for the updated corona information, and also if you are planning to travel or going back to the place or your school, it is allowed. It is necessary travel, so you can do that. So travel to a place of study may be deemed necessary, and yeah, that's it. And you can also check your COVID info updated information. Next slide, please. So during this Easter holiday, everyone is excited for outdoor activities because of the lockdown. Everyone wanted to go out. Well, in Norway, they have this saying, "Gå på tur og aldri sur." Men du må forsiktig, which means is going go out and walk and hike, but you must be cautious and you must be careful. So, outdoor activities, swimming, beach life in Norway, there is no risk of COVID-19 transmission via the water when bathing in fresh or seawater. So, but you have to try to find beaches or swimming areas with fewer people. This usually, mostly, not all are swimming, but this will apply during summer days. Yes. And fewer people means less transmission. Yes. And next slide, please. So outdoor activities, but like camping, hiking, biking, horseback riding, farm holidays, and other types of adventure holidays within Norway can be carried out as long as you remember the general infection control advice, which is the SFHD. Stay at home when you're sick, wear a face mask, have a good hand hygiene, and keep 2 meter distance. Next slide. Next will be the advice for risk groups and relatives. So the risk groups are from the age group of 50 years old to 64 years old with chronic diseases, and 65 years old and up, or the elderly. So if they are planning to travel, the first advice should be an individual assessment. Individual assessment whether or not to travel and with whom you can travel with. So for the risk groups, it is better to stay at home or stay at your cabins if you want. And also, if there is increased transmissions at the destination, those at a higher risk of a more severe disease progression are discouraged from any travel under such situation. So it is you have to stay home and maybe stay in your cabins, and yeah, and just have a sip of wine. Yes. Next slide. People with a higher risk should consider the following: proximity to those they are traveling with, which is the 2 meter distance, and also to those who they are not normally in close contact with. Still, we have to maintain the 2 meter distance. The number of people they are traveling with, whether it will be possible to have is separate bedrooms and toilets during the journey. Next slide. So next is the advice before you travel abroad. Check the measures and restrictions of the country to prevent transmission of COVID-19. Travelers must also be prepared to answer questions about their health. Check the quarantine rules and also the requirements of every airline, because every airline have a different regulations. Some airline required a COVID-19 test, some are not. Yes, that's it. And you have to plan your tour, and you have to research everything, especially you want to travel abroad. Yes, next slide. So the Ministry of Foreign Affairs is advising against all non-essential travel abroad. This applies until the 15th of January 2021. But this advice has an exemption for countries in the Nordic region, EU, EEA, and the Schengen area that have sufficiently low transmission. They are allowed to travel. But um, it is supposed to be a necessary travel, like work travel, or so not for fun travel, no, but for necessary travel. Next slide, please. So it's better to check the advice from the local authorities at your destination. Check what is covered by the travel insurance, including what applies if you become ill while traveling. So always be updated, and always update your insurance company and call them also if you become ill, if they will cover it or not. Yes. Next slide, please. So these are the risk factors you have to consider before you travel. It is risk of being infected while traveling, destination, duration, contact with other people. Next risk is the travel restrictions. There are curfews, quarantine, or measures in the country you're traveling to, if you want to go into that hassle. Next is the capacity limitation in the healthcare service at the destination if you become ill, the lack of possibilities for return travel or medical repatriation, and not being able to visit a healthcare institution. So that are the risk factors you have to consider before you travel. Next slide. Oh, yeah. The infection situation and local restriction can change very, very quickly. So you have to be updated. And one considering a trip abroad should think carefully about whether it is necessary to travel. Next slide. So I will end this report from the speech about the coronavirus situation by the Prime Minister Erna Solberg last March 7, 2021. But most important of all, we have you, all of you. We have each other, and we have confidence in each other. Each and every one of you has played a role in helping us to beat the pandemic. Together, let us all thank each other for our efforts so far. Let us work together to scale what we hope is the final incline. So thank you so much, and that's it for the advice for travel. And now let me call on my teammate Yons to give you the advice and information for children and adolescents. Yes, Yons. Yes. You can be updated and be updated in the fhi.no. You can check the informations there. Yes,
Yep.
Yons.
Yep. Thank you. And that is very well said. So it's really important to take the advices from the NHI in regards to traveling during these pandemic times. And also, please bear in mind to think carefully about whether it is actually necessary to travel or not. So, hello again. My name is Jans, and I'm about to give you advice and informations on issues affecting children and adolescents. So, these informations were actually taken from the Norwegian Institute of Public Health that was actually updated from March 5th. So let me give you first a brief overview of what coronavirus is. So SARS-CoV-2 is actually the name of the virus that is causing the outbreak of COVID-19 disease. Its main symptoms are actually fever, chills, cough, body aches, headaches, tiredness, loss of taste or smell, and shortness of breath. Next slide, please. So children seems likely to become infected or ill. Why is that so? The NIPH actually monitors knowledge about the role of children in the spread of COVID-19. So, together with the European Center for Disease Control, or ECDC, they have combined the following knowledge, um, which actually indicated that children of primary school age and younger are actually less likely to become sick for coronavirus. It is actually when they become ill and usually have milder symptoms and a mild disease course. Also, children can be infected and have symptoms, but to a lesser degree than adults. It is actually, since they have fewer symptoms than adults, it is actually assumed that they are less contagious. And it is actually rare that they infect other children or adults outside their household. This is actually supported by the findings from the Norwegian Corona study. Lastly, the transmission in school and childcare centers contributes only to a small extent in the spread of COVID-19 in the society. Well, the start of school year in August actually does not appear to be the cause of the second wave of COVID-19, which was actually seen from October 2020. So adolescents, in the other hand, or what we call the teenagers, are actually probably more contagious than children. This is actually because they get more symptoms when infected with COVID-19. Adolescents may also have a lifestyle that increases the risk of transmission. So their ability to infect others actually appears to increase gradually until adulthood. So until they become adult, actually. So moving on, it actually shows that children with chronic diseases have a low risk of severe COVID-19 disease. So it appears to be a very low risk of severe COVID-19 disease among children and adolescents in general, but also among children and adolescents with chronic disease or conditions. Next slide, please. Thank you. So the question is, should children and adolescents be vaccinated with corona vaccines? The vaccines that are now available that are approved for use from 18 years and older, with the exception of BioNTech and Pfizer vaccine, is only approved actually from 16 years and above and can be used in adolescents with a high risk of serious illnesses. And for those who are actually worried about your sick child or adolescent, you have to contact the health service to see if they should be assessed by a doctor. Do not delay seeking medical attention due to concerns about being infected with COVID-19. So please remember that one. So, in general, the younger the child is, the lower the threshold should be contacting a doctor, okay? So, when do you think the time it is to contact the doctor? So we actually have to contact the doctor when the child or adolescent is not feeling well or is actually lethargic. Also, if the child is actually having difficulty of breathing or breathing faster than usual when resting. And lastly, if the child or teenager is experiencing or having fever combined with respiratory tract symptoms or poor general condition. Next slide, please. So, children who actually have had symptoms of respiratory tract infection in the last 24 hours should actually stay at home, especially if the child has several symptoms at the same time and is not feeling well. If the child only has runny nose, for example, and is otherwise in a good general condition, then there is actually no need to stay at home. So please actually take note of that. And when do you think the child could actually return to childcare or school? So if the child had been tested for COVID-19, the test result must be available before the child can actually return to the childcare or school. So for everyone who is actually diagnosed with COVID-19, then they must be in isolation and it will be followed up by the healthcare services. So what if other family members have been diagnosed with COVID-19, right? So the child must be in quarantine together with the family, and they will going to be followed up by the healthcare services as well. Okay, so adolescents who actually have developed symptoms of respiratory tract infection in the past 24 hours time, should actually stay home from school and contact the local testing center to be tested for COVID-19. This also applies to adolescents with mild symptoms, okay? Also, so as we all know, many children have several homes, right? So the main rule is that we need to plan meetings as agreed by both parties. And this rule should also apply, to the UK virus variant as well, which is pretty new and have been detected in the local community. Also, it is also important that the child needs to be taken care of as well, even if the guardian has COVID-19. Similarly, if the child has COVID-19, they must receive adequate care and attention from parents or others, even though this may mean that it is not possible to keep a distance. But this is very important for the children. They must receive adequate care and attention from parents or other people. Next slide, please. So the municipalities should actually ensure that the health services offered to children and adolescents are actually adequate or enough. It is actually recommended that the health station and then school health services should maintain normal activity in line with national professional guidelines and necessary infection control measures. So, what about the childcare centers, schools, and after school programs? What about that? So, the Norwegian Institute of Public Health and Directorate of Education and Training have actually prepared infection control guidelines for childcare centers, schools, and after school programs. The guidelines actually describe measures to reduce transmission and provide advice and support to ensure good infection control for the staff, for the children, and for the adolescents as well. And actually, if you need more information about the infection control measures in childcare centers and school, as well as advice on end of term activities and events, you can always check the NIPH website for that one, okay? Just visit the Norwegian Institute of Public Health website. Now, how can we manage to have our children play with friends and our teenagers go on to events or attend parties despite the fact that COVID is actually still present? How can we manage that one? We actually have to limit the number of guests that are present at the same time. So this actually applies to both indoors and outdoor gatherings for both children and adults. But the risk of transmission is actually pretty lower outdoors than indoors, and when playing in small groups as well. So we actually have three general control measures, which actually applies to everyone, not only to children and adolescents. And I hope that you guys would take this by heart. The first one is the sick people should actually stay at home or go home if they develop symptoms. Next is we also need to have good hand hygiene and cough etiquette. In the Philippines, we actually have this uh the if we have to sing like a happy birthday song in order for us to make sure that we have cleaned our hands pretty well. So you have to sing it twice with that one. So lastly, we also need to limit contact between individuals that do not live in the same household. So those are the three. So please take it by heart and please remember that one. It will gonna be a big help for preventing coronavirus and such thing. So, can children still play despite the fact that COVID is actually present? Yes, of course. Kids need to play and they need social contact in their leisure as well. But the new normal is that there will always a but, which actually means that despite letting our kids play, we still need to provide infection measures to prevent the spread of the virus, isn't it? So we have to remember that for children play, we actually have to remember that children who play together do not have to keep a distance. But children should actually keep their distance from other children who are not in the same group. Okay? That makes sense. And also, adults who accompany children to activities and play should always keep their distance from other children and adults. So we always have to weigh up limiting or keeping our distance from other people, okay? We always have to put that in mind. And for an adult who actually needs to comfort or help a child outside their household, we need to keep a distance to others as well, okay? So children could actually, children can have friends for sleepovers if everyone is actually well inside the house and the guests are among the same close contacts as in school and leisure time. We have to remember always, we just have to meet the same people every time. You can't just meet other people. Like, we have to make sure that the people we're meeting are the same people that we want to meet every day. So the other members of the family should actually try to keep a distance from the guest who is actually sleeping over at that place. Okay? And for adolescents, they can also have a few friends or contacts that they do not need to keep their distance from, and who are actually considered to be their close contacts. And they should also be the same over time, okay? That's actually the best thing that we can do to limit the spread of the virus. And I hope that everyone could actually follow that with that. So, how about throwing a birthday party or celebrations or events? Is that even possible this during this pandemic times? I guess it is. So, we actually need to limit the number according to the current advice and guidelines for events. Both children and adults are actually included in that one. So it may be necessary to split the class in two or ensure that not too many children and adults are present at the same time. And we always have to remember clean hands for everyone, especially when food is ready. I mean, when the food is actually served. It's actually pretty basic, but we actually have to remember that if you're not sure, just clean your hands. It won't kill a bug. Just clean your hands every time you we need to take note that leisure activities are actually important for the physical and mental well-being of the children and adolescents. They can still engage in leisure activities in a safe way that will reduce the risk of infection. So, where there is a need for strict infection control measures, you have to try to maintain some activity as long as possible. Next slide, please. Thank you. So, need general advice about coronavirus, you can always look up the NIPH or the FII website or the healthnorge.no. And if you actually want an information helpline for questions about coronavirus, of immigration can actually help you with questions about traveling. This actually including strict entry rules to Norway and appointments with the police and questions regarding quarantines. You may call their helpline number, which is 2335 1600. That is actually open on weekdays from 10 a.m. till 2 p.m. So, in addition, the Ministry of Foreign Affairs had also given advice against non essential travel to all countries that will remain effective until the 5th of April. They urge all Norwegian citizens who are actually traveling abroad to consider returning home ASAP in a safe and calm manner, in consultation with their travel agency or airlines as well. So, for those who actually need acute medical attention, you have to contact your doctor. But if you cannot reach your doctor, you have to contact the emergency out of hours clinic on 116117. Okay? And we also have a very important 3-digit phone number that you can always call if your life is in danger. This is only a 3-digit phone number, so please don't forget it. 113. So please remember that one, okay? So I guess this is everything that you actually need to know about on how to take care of your children and adolescents in connection with coronavirus. I do hope that you all have learned something from what we have discussed Thank you so much for listening and staying with me as well. Again, my name is Yons, and let me introduce to you our next reporter, Miss Ching, to give you updates about pregnant women in connection to COVID as well. Here you go.
Thank you, Yons. Wow, that's very essential. So, I just want to thank you for sharing us the information and advice that children and adolescents should do it to minimize the chance of getting infected with this virus. And also, it's very important for them that they heard about what you said and for them to be aware of what they should do in case they get infected. I hope everyone will keep those infos in mind. So now allow me to discuss advice and information for women and breast who are pregnant or breastfeeding. This is from Norwegian Institute of Public Health, and it was published March 14th, 2020, and last updated last March 4, 2021. Okay, next slide, please. Okay, so I'm going to discuss pregnant and breastfeeding women. Next slide. Pregnancy. Pregnant women may have increased risk of more severe course of certain viral infection. Studies so far shown it appears that pregnant women with COVID-19 who develop symptoms have slight greater risk of needing treatment in hospital. So dito po, the most common symptoms for the among pregnant women are just like other general symptoms like coughing and difficulty of breathing, but fever, moderate general symptoms are not as common compared sa mga non-pregnant women. So, sa mga pregnant women, in case they have this virus, hindi po nagmamanifest ng fever. So, hindi po siya, yes, so sa difficulty of breathing lang po yung nagmamanifest when the pregnant woman is infected. So, we also have a risk group for this severe course COVID-19 are the same for others underlying conditions such as diabetes, cardiovascular disease, or heart problems and obesity. There is also risk for premature birth. So pag ganito po, yung pag may mga cases na kailangan nilang mag-give birth before the due, the usual process is cesarean section. So also, um, pero po, there's no, COVID-19 has not shown to increase the risk of miscarriage during pregnancy. So usually po, ang nangyayari lang is premature birth, pero yung sa miscarriage is not proven yet. Okay, so in case of premature birth naman po, cortisone is given in 2 doses to the mother to promote fetal lung development in the event of impending birth before 34 weeks. So, yun po. It is also given according to the usual guidelines in pregnant women with coronavirus infection with serious illness. Next slide. Women who have symptoms of respiratory infection or who have confirmed COVID-19 must contact the healthcare service before checkup to discuss how this should be carried out. Next slide. So, if pregnant women are concerned for their own health or the health of the fetus, extra checkups can be carried out according to the usual criteria. The Norwegian Gynecological Association has issued advice about pregnancy checkups for women with COVID-19 outbreak. So, as a mother, you should know if may something wrong na doon sa dinadala mo. For example, medyo hindi na siya masyadong magalaw. So, less fetal movement, water loss, may contraction na, and then suspected reduced fetal growth and other issues. So, yun nga, sabi ko, as a mother, we should know better, di ba? So, isipin natin na may munting buhay na nakasalalay sa atin. So, we should be very careful and be very aware kung ano na po yung nangyayari sa baby natin. Okay? Next slide. Women who have symptoms of respiratory infection or have confirmed COVID-19 must contact the healthcare service before checkups to discuss how this should be carried out. So, okay, pag ganito po, may nararamdaman na tayong symptoms and then worried ka naman na pumunta sa hospital since alam natin na sa hospital is hindi siya, you might, mahawa ka pa sa mga sakit, di ba? So, it is very important to call the maternity ward by phone with question related dun po sa mga symptoms na nararamdaman mo and also about dun sa baby na dinadala mo kung may nararamdaman ka ng hindi magandang nangyayari doon. And so, by checking at the hospitals, by the hospital, the meeting place, time must be agreed to limit exposure or infection. So, it's very important po to call the maternity ward bago tayo magpunta doon. So, para maiwasan na din natin ng unnecessary exposure. Next slide po. Okay. Vaccine. There is little experience with vaccination of pregnant women and breastfeeding women. Therefore, there is currently no general recommendation for vaccination of pregnant women. Okay. Pregnant women who are at risk of serious disease caused due to another illness that is prioritized for vaccination can be assessed individually by doctor when they are offered the vaccine. Breastfeeding mothers are given priority for vaccination due to another illness or occupational situation can be, pwede po siyang pag-usapan with the boss kung ano po yung dapat gawin. Okay, next slide po. Okay, birth and maternity. There is uncertainty about whether coronavirus can be transmitted from mother to child before or during birth. Babies born to mother with COVID-19 that have been infected after birth have had mild or no symptoms. So, dito po, it is not proven and or there's no studies na if the mother is infected with the COVID-19, hindi po niya natatransmit yung virus sa baby during birth or after birth. So it's no, it's very very low possibility po. And also, there is no evidence that the baby is infected during birth. That means that the birth can go as planned. Also, published study from China that it does not detect viruses in amniotic fluid, umbilical cord, or in the baby's oral mucosa immediately after birth. So, di ba yung sinasabi ko kanina? So, hindi po siya natatransmit dito sa sa mga liquids na ito. Also, transpas transplacental transmission is very very low. So it's only partially the virus partially penetrate the placenta. So it's no chance po talaga na through placenta matatransmit yung virus dun sa baby if ever the mother is infected po with the virus. And next slide. Okay. Breastfeeding. Coronavirus has not been detected in breast milk from women with COVID-19 infection where there has been studied. Women with COVID-19 infection can therefore breastfeed normally, and this is also advice from the World Health Organization. So, as a mother, ako po, tatlo na po yung baby ko. So, I know na napatunayan ko po na breastfeed is still best for babies. For example po, yung sa colostrum, yun yung dapat makuha ng baby kasi yun is full of immune. It helps develop the immune system for the baby. So napoproduce po yun on the first 3 days after birth. So we have to be very very patient and kailangan po ng baby na makuha yung colostrum ng mami para po sa ikabubuti po ng bata para din po sa kanyang safety and for the baby's immune system to fight the virus in case the mother has um, infected with the COVID-19. Next slide. Okay, healthcare professionals who are pregnant Healthcare professionals with patient contact are at risk of exposure to infection from sick people who need medical attention. The recommendation infection control equipment should be used by all healthcare professionals during contact with a patient with suspected confirmed COVID-19 disease. As a precaution for healthcare professionals who are pregnant, it is recommended that other healthcare professionals should take samples and treat people with probable, suspected, and confirmed COVID disease where possible. Workplace adjustments should be done in consultation with the employer. Next, meron pa ba tayo? O kung wala na. Okay, so isa-summarize ko lang po. Kailangan po nating tatandaan na to prevent infection, kailangan po ng good hygiene o lagi nating pong nakikita yan, mga sinasabi nila. Always keep your hands clean, cough etiquette po, and limiting the close contact, especially pag pregnant ka. So, kung hindi mo kailangang lumabas, wag na lang pong lumabas. At kung may pwede po naman tayong pakiusapan, mag-run ng errand, then it should be better rather than ma-expose po tayo at may bunting buhay na nakasalalay po sa atin. Also, avoid touching surfaces when we are in public places. Also, 2-meter distance. And don't forget to boost our immune system. And also, let us not forget to keep ourselves updated by the following local media and IPH website or healthsenorge.no. And now let us hear from Stephanie.
So, we learn about information and advice to travel, information about adolescents and children, and we learn about information of pregnant women and breastfeeding, and now, and very last topic to discuss is the general information about respiratory children with respiratory tract information. Anyway, thank you Eloisa, Jinx, and Yons for a very important topic to discuss in this time. So, when children have acute respiratory tract infection, what should we do? Many parents are unsure how to assess whether children with respiratory tract symptoms need to be kept at home. So, the Norwegian Institute of Public Health had produced a flow chart to help them. Consult your doctor if you are concerned about your children. All our report sources are Polke Helse Institute that NO, published at 18 of September 2020 and updated at March 3, 2021. Next slide, please. Symptoms of COVID-19 in children. Children of primary school age are younger are less likely to become sick from coronavirus and play a smaller role in transmission. If they do become sick, they usually have a mild course of COVID-19 disease. Their symptoms are often mild and short-lived and can be difficult to distinguish from other respiratory tract infection. Because of yung children nga po, less likely siya na magkaroon ng sakit due to coronavirus. So, mahirap po siyang i-distinguish. So, we will help you how to distinguish the coronavirus and acute respiratory syndrome for children. Respiratory tract symptoms including cough, sore throat, nasal congestion, and runny nose. Children with COVID-19 may not have fever and cough. Take note of it. Children with COVID-19 have not fever or cough. The youngest the children often do not complain of sore throat and body aches, but they have a more usual or they don't want to eat. It's called poor general condition or lethargic. Usually, when the children was lethargic, there's a underlying disease about it. So it's a good sign that you can call the doctor and bring the kids. So next slide, please. When you are worried about your sick child, contact the doctor Contact the doctor if the child has poor general condition, the child is lethargic, and no usual self-altered behavior. So, when the kids are very tired, sleepy, and they are not usually their character, that is a symptoms that you need to call a doctor. Difficulty of breathing and difficulty of breathing or breathing faster than normal when at rest. Fever with a combination of respiratory tract symptoms and or unfeeling unwell. Like I said, when the children have not their usual character, that is the symptoms that you need to call a doctor and to bring the kids for a checkup. So next slide, please. Children with respiratory tract symptoms should be kept at home from children and school age. So if you are a parent and you don't know where you will bring your child at the school or child care, this information is for you. If a child has a symptoms of respiratory infection for the last 24 hours or newly arise, they should be kept at home, especially if they have several symptoms at the same time, or if they have a poor general condition or lethargic. 24 hours when is newly arise. So the respiratory infection newly arise 24 hours or equivalent to 1 day. So they should be stay at home. Second, children with only mild respiratory symptoms and have no fever can be observed at home for 48 hours or equivalent of 2 days. With a rapid recovery, the child can return to child care or school without being tested. Remember that when the symptoms cannot the child cannot be school without being tested. They can go back to school without tested after 48 hours. If there's no improvement after 48 hours, contact the health service to assess whether the child or need to be examined by a doctor or tested for a COVID-19. So 24 hours, newly arise, 1 day, the children should be stay at home and stay safe. So after 24 hours and mild respiratory symptoms, no fever can be observed for 48 hours or 2 days can be stay at home and not and not and school without being tested. But if there's no improvement after 24 hours, that is the sign that you need to call the health services to assess whether the child can be examined for COVID-19 or not. Next slide, please. So, if you're suspected for a COVID-19 for children or adolescents, these are the information that we should need take to consider. When should adolescents and adults stay home from school, work, and can be tested for COVID-19? Number 1, do you feel unwell or do you think that you are infected? Stay at home. Contact your doctor if you need help. Number 2, if do you have fever, cough, sore throat, difficulty of breathing, or have lost your sense, taste, smell, or suspect that you have a COVID-19? Yes, contact the testing center to arrange the testing. Stay at home until the test result is available. Remember that. If you have symptoms, contact the testing center and arrange for a test. And stay at home until the test is available. And you can you cannot return to school, you cannot return to work, and you have no symptoms. So number 3, did the test confirm that you have COVID-19? If yes, you should be isolated. Your municipality will follow you and will contact you with close contacts. If no, you can return to school, work when you do not have fever or feel well, and a mild cough or similar to that may can lingers okay. If you have a mild cough, you can go back to work or to school. But if you confirm that you have a COVID-19 positive test, that is the tricky one. So you need to be isolated and call your municipality for contact tracing of your fellow people that you've been in touch with. So next slide, please. When the children are primary school age or younger can return to childcare or school. A child general condition determine when they can return to childcare school or after the respiratory tract infection. Remember that they should stay home 24 hours or 1 day if they newly arise, or they can observe until 48 hours. And then if there's a symptoms, you can call a doctor for a COVID test. But when they will return to school, the child general condition is important. So the child general condition is that determine when they can return to school or not. As long as the residual of the symptoms are past infection, are not newly arise or becoming worse. The child can return to childcare, school, when the general information is good and back to normal for the child. If the child has been tested, the, the, the test result must be available before they can return to childcare, school, or anyone who is diagnosed with COVID-19 must be isolation and followed up by the healthcare services in the municipality. So the child must need to wait the result before they can go back to school and the childcare. But the result it must be negative. So if the child have a positive, probably they need to undergo isolation. So the child the child can return to childcare school even the family have respiratory tract symptoms. Yes. If there's no other family with COVID-19 and the municipality will be follow up for the sick children. So next slide, please. Next slide, please. When the children of primary school age and younger age, the public health clinic, doctor, surgery, and other services. For example, the children wanted to dental check up or something like that. So the children of primary school age and younger can do a public clinic, doctors, and surgeries and other services. Children with residual symptoms following recovery of the infection which are not new or increasing as I described above, they can attend the public health clinics, the doctors, surgeries, and other services with their general condition is good or a normal for a child. In this way, the children can still receive the necessary saturation follow-up for a barrier services. So, the relationship building and security are the major part of the follow-up for children and adolescents. So physical consultation must be strived for it cannot be always replaced for a digital consultation because there's a lot of people that getting depressed in this time of pandemic, so the relationship building and security are the major part of follow-up for children and adolescents. So it cannot always be replaced by a digital consultation. Sometimes they really need to go to the doctor to physically consult them. For adolescents, if they have no symptoms or asymptomatic, they can attend consultation as normal. If adolescents have symptoms, consider that they can contact or now attend the services. If they need to meet up a person with a negative corona test, they should be available for adolescents when is the appointing position is appropriate. So, I hope that we provide you a lot of information regarding this COVID-19. I know that you learned a lot today. And all our report is from FHS.no, Polke Health Institute. Thank you so much,
Uh,
everyone, for listening
Okay,
with
so
us.
Okay, so those information are definitely a must know. Thank you, Stephanie, for sharing it with us. It is actually crucial that each one of us will follow the rules to stop the spread of corona and mutated virus as well. And these measures might change. So keep yourself updated through watching the news and press conferences of the Norwegian government.
Here are some of the reminders from the Philippines Yelpesampun in Norge. This is part of integration and voluntary activities of our organization. The work is primarily aimed at Filipinos and other minority groups living in Norway and Filipinos in the Philippines.
So visit our FB page .fhs.org.no and our website www.fhsnorge.org for more information, updates, and other information drives.
Mm.
This has been PandemChix. My name is Eloisa. Again, we hope that everyone will stay safe. Always remember the general infection control advice. Stay at home when you're sick, wear your face mask, have a good hand hygiene, and keep 2-meter distance. Be updated and follow the new rules amidst the threat of this mutated coronavirus.
I totally agree with that. Let us all unite in fighting against coronavirus and the new variants by adhering to the measures. Again, this have been Yons.
And this is Stephanie. I hope that we provided you enough information to help you combat this COVID-19 and the new variant in this time of pandemic.
And my name is Jake. Thanking everyone for watching here in FSH COVID Infodrive 2021.
To be updated of the corona report, you can check the Norwegian Institute of Public Health website www.fhi.no, or you can check the regulations from your respective municipality's website.
Indeed. But for now, let us end this report by reminding all to keep the faith up and follow the preventive measures.
Stay calm, healthy, and corona free.
And let us all be safe and positive always, everyone,
And always remember,
It's better.
to be safe.
Then sorry, hada!
hada, hada, hada.